let's discuss the principles of pharmacology. Pharmacology is the fundamental knowledge of medications and their uses and when it is appropriate to administer them. When it's appropriate to administer them is all part of medication safety. You have to realize that you're giving something to a patient that you can't take back. Once it's in the system, it's going to start working. So when you're giving medication, you got to make sure that the patient meets the components necessary to take that medication. There's different ways that we administer medications. There's the self-administration, there's the peer administration, where a family member is able to administer, or our ability as EMTs to assist the patient or administer medications that we provide. To understand pharmacology is to understand a few clinical terminology of medications. You've got to know their names, the effects they have on the body, what actions they do to cause that effect, when is it indicated to use this medication, and most importantly, when should you not use the medication? What are its contraindications? Not so much contraindications, but giving medication can cause complications. So you have to be aware of the complications that can occur. A complication of giving an EpiPen is cardiac arrest. That is a complication. That's some complication, by the way. And when you understand the routes of administration, the way that drugs are prepared by the pharmaceutical companies, they are prepared for that specific type of administration. You're going to understand the side effects, how they interact with other drugs, and the proper dosage. So, giving medications is serious. It is not something that we take lightly, and you shouldn't just dispense medications on a whim. You have to make sure that the patient meets the requirements that are necessary to have this medication administered to them. They can alleviate pain and improve their well-being, but it's bad enough that you can kill them. So this is very, very serious. As an EMT, you're going to be administering medications. The most common medication to administer is oxygen. Okay, but there are other medications out there that you will be administering. You can also help patients self-administer. You're going to find out before this administration how they've taken this medication. Have they taken it before? When was the last time they took it? And most importantly, when you administer it, it has to be part of your patient care report that you give to the hospital. So what is pharmacology? It's the science of drugs. And drugs are used to help the body achieve balance. And they can also prevent disease and relieve pain. These drugs work on the body cellularly. They affect the structure and the work of cells. And that's known as pharmacodynamics. There are receptor sites on the cell membrane of cells that constantly monitoring and looking for a molecule to come by that can lock on to the receptor. Locks it on, and it activates a protein that tells the cell to do a specific function. The drugs that lock onto a receptor site to do that is known as an agonist. Now, an antagonist will, instead of locking on and activating the receptor site, it will block the receptor site. So, the receptor site is unusable and the cell cannot perform that function. So we either cause a cell to work or we block a cell from working. Now, the amount of the drug that we give is known as the dose. And it is dependent upon a lot of different factors. You have a standard adult dose because the adult has a standard body system, and it's usually not a problem. Children, we deal with weight-based drugs. So age is a factor, weight is a factor, especially in the very young. And the desired action is an obvious factor of why we give you medication. Medication has an action. The action is what you want to occur. If the patient is wheezing, you want the medication you give to relieve the bronchoconstriction. That's the action. And a drug that we give is a beta agonist called albuterol. It is an agonist for beta receptors that are located on the smooth muscle of the bronchioles. And when that agonist, the cell receptor is activated, it creates a protein that instructs the cell to relax. How do proteins instruct cells? Very simple. Proteins are the language of cells. It's how cells communicate with each other. Proteins are created by transcript RNA, produced in the cells, activated by these receptor sites. Proteins are strands of amino acid, stringed together. Now, amino acids, you could say, are words. Proteins are sentences. They're the commands. So a string of these amino acids together create a protein command that tells the cell to do a specific function. And when you give albuterol, it hits the beta-2 receptor that creates a protein that instructs the smooth muscles to relax. When the smooth muscles in the bronchioles relax, we open up the bronchioles and we no longer wheeze. So that's our desired effect. That's the action of the drug. So its indications are for asthma. Its contraindications are limited because it does very little damage in the body if given to the right people. But it has some side effects. Unintended and intended, and untoward, which is dangerous side effects. Albuterol doesn't have a lot of untoward side effects, but it has some unintended effects. And that is there are beta receptors on cardiac cells. And when they're activated, they create a protein that doesn't tell a cell to relax. It tells the cardiac cell to beat harder, stronger, faster. So when you give albuterol, you're going to affect beta receptors on the bronchioles, the lungs, but also cardiac cells. So the tachycardia that's going to come from the cardiac cells beating harder, stronger, faster is a side effect. It's an unintended side effect, but you have to realize that it exists. It takes years to create a drug that's approved by the FDA. There are clinical trials that drug companies have to go through that can sometimes take decades. Testing in the lab, testing on animals, testing on humans, before they get approval by the FDA. Once the FDA approves the drug, it's inserted into the United States Pharmacopoeia. And you are given, the drug is given a generic name. That's the original name that the FDA has given the drug. So you can tell you have a generic name because it says comma USP after it. Oxygen is the most common generic drug. If you look at your oxygen tank, it'll say oxygen, comma USP. So that's the generic name. The drug company that created the drug has a patent on the drug. And no one else can create that, can recreate that drug until the patent wears out. The company that owns the patent names it, gives it its trade name. So an example of a trade name is Tylenol. The generic name for Tylenol is acetaminophen. So if you go to CVS Pharmacy, you can see that you have a whole line of pain relievers, and you have your ibuprofens, you have your Motrins, you have your acetaminophen, you have your Tylenols. Only one company can name it Tylenol. All the generic stuff is called acetaminophen. And it's allowed to have generic drugs now because the patent for Tylenol has run out. So anybody can make it. And that's good because the price tends to go down when there's competition in the marketplace. So we have those types of drugs. The trade name, the generic name, okay, the name that goes, the official name that's in the United States Pharmacology. They're all the same drug. Now there's ways that we can acquire drugs. We can get them without a doctor's prescription. That's called over-the-counter. We get them with a doctor's prescription. Okay, and those are our legal drugs. Now we have some drugs that are not regulated by the FDA, like vitamin supplements, enhancement drugs, okay, herbal meds, drugs that you hear on TV all the time. They're spouting all effectiveness with weight loss and attention deficit disorder, all these things. Not regulated by the FDA, not in the United States Pharmacology. And then, of course, we have recreational, street drugs. We have our illicit drugs, and we also have prescription drugs that are abused and used as street drugs. Drugs like oxycodone, for example. So you understand how drugs are created and the difference between a generic and a trade name, the difference between prescribed and non-prescribed, and just drugs that you find all over the street. There are different ways that drugs are administered. There are two major ways, enteral and parenteral. Enteral involves the GI tract, and parenteral involves everything else. I like to say that parenteral is anything that medics can give. It's given by paramedics, parenteral. And some common routes for enteral is rectal and PO. Parenteral is IV, IO, subcutaneous, intramuscularly, inhalation, sublingual, transcutaneous, intranasal, with an atomizer. Now all those drugs I described are all given by paramedics, and they're all parenteral drugs. So that's just how I remember it. Rectal, there's some systems that give rectal, but it's the only one that involves the GI tract with oral. Rectal is a fast enteral, and then we see all of these, outside of subcutaneous, the rest are very fast. Inhalation is fast, sublingual, and IV and IO are appropriate for emergency medications. Now the way the medication is prepared, the form that is prepared is designed for a specific route. Now, for instance, you can have a drug that comes in different forms. You have nitroglycerin, for example. Nitroglycerin you can get as a tablet that dissolves under the tongue. It comes in a spray form. It also comes in a liquid form for a nitroglycerin IV drip. The manufacturer creates it, and they create it in the form that it's designed to be given. You can't give nitro tablets intravenously. That's not the way it was formed to be administered. So these are your basic forms: tablets, solutions, meter dose inhalers. You have topical drugs, transcutaneous. Like you think about the smoking patches, the nicotine patches are transcutaneous. Gels, and of course gases. The most common, as I said before, is oxygen. So tablets and capsules. Capsules are gelatin filled, while tablets are usually mixed and compressed. Solutions are mixtures. An example of a good mixture, it won't separate by filtering, so you don't have to shake it before you use it. An example is nitroglycerin spray. A suspension, on the other hand, has to be shaken in order to work effectively. And a suspension, we have like activated charcoal. A common suspension you can get at the supermarket is a Yoo-hoo shake. You have to shake it up before you drink it, or trust me, it tastes terrible. Meter dose inhalers, or MDIs, these are liquids that, well, by depressing, become aerosolized and therefore able to be inhaled. And it's a metered dose because it gives the same amount with each pump. Topical meds, now we're talking about lotions, creams, ointments, and like calamine, hydrocortisone, neosporin. These are drugs that are able to be absorbed through the skin. A lot of things can be absorbed through the skin. Skin is not completely a shell. It is porous in some aspects, but it is waterproof. We have things like patches, like a nitroglycerin patch, or an adhesive patch, or a nicotine patch. These are known as transcutaneous patches. They get absorbed through the skin as well, but they don't do it in the form of a cream. They have an actual patch, a medicated patch that goes on. And here's an example of a nitroglycerin patch. Now, it's important that if you touch this medication, it's going to be absorbed into your skin. So we always handle topical and transcutaneous medications like any other medication with our gloved hands. Gels are semi-liquid, very common. Most common we have is glucose, instant glucose. And once again, they don't have to be shaken up. They're administered, and they can be instant glucose is able to be given sublingually or buccally between the cheek and gums, because the vasculature of the mouth is able to absorb sugar rapidly. It's not given PI. We can see our most common gas, how it's given, most commonly through normal breather or nasal cannula. So when you're administering medication, you got to realize that it's going to send messages to the cells to do specific functions, and you can't reverse it. So you've got to make sure that you're giving it appropriately. And the way you do that is by following what's known as the 6 rights of medication administration. Okay? Is it the right patient? Did we interview the patient correctly? Is it the right medication? Is it the right dosage? Is it the right route? Is it the right time? And did you document correctly? Some very common medications you'll find on your ambulance. The national standard of care. Oxygen, oral glucose, activated charcoal, aspirin is now in, and EpiPens, adult and pediatric. You got to realize that there's different ways to administer these medications, okay? And you have to follow your state and local protocols. They change nationally. So whatever region you go to, you have to adhere to the local protocols and the policy of the department in which you are working. So what are some advantages of oral medications? It's easy to self-administer. Some disadvantages, it's slow. It goes through the digestive tract. That could be bad. Okay, and there's a possibility of aspiration, vomit. What does activated charcoal do? It acts as a chemical sponge. It keeps drugs from being absorbed. Instead, it absorbs into the alcohol. So it's ground into a fine powder, and it's suspended in a substance called sorbitol. You shake it up, it's a suspension, and you give it by mouth. When is it contraindicated? Nothing goes by mouth on any patient who has a loss of consciousness. In addition, if they've ingested an alkali or an acid or a petroleum, it's not effective. So it's contraindicated for that. It will not absorb those substances. It may actually cause more damage. So once again, before administering it, get a full assessment, history, find out exactly what was ingested. Now, oral glucose, used to treat hypoglycemia. It's only given by mouth, and the contraindication for it, not given to an unconscious patient, and a patient who has an uncontrolled airway. Aspirin, it's one of the oldest drugs in the world. It was invented by Hippocrates, and it's actually came from the willow bark. bark of a willow tree, and the ancient Greeks used to chew it. The willow bark has acetylsalic acid. And they found in the pain relieving ability of acetylsalic acid, they also found that it reduces clotting. So by reducing clotting, patients having chest pain, you have the ability to not have a blockage, to reduce the blockage in the coronary arteries. And that's why it is the standard medication, initial medication to be given to somebody with chest pain. When is it contraindicated? You have a hypersensitivity to it. You have any type of liver damage or any type of GI problems because it's chewed. It's not a PO. You chew it and it's absorbed in your oral mucosa. That's why it's baby aspirin. Baby aspirin is non-enteric. Baby aspirin is chewable aspirin that we administer. So some advantages to these sublingual medications. It's easy to give to the patient or have the patient self-administer, and it absorbs quickly. But the disadvantage is if you don't have a good airway, you can't give it. And there's a potential that the patient could choke on it if they don't know how to administer it to themselves. So you don't give it to uncooperative or unconscious patients for that reason. So these sublingual medications, the primary one we have is nitroglycerin. So cardiac patients with chest pain, what this does is it dilates coronary arteries. So it widens them out, and any clot that was there starts to move. So taken in conjunction with aspirin, prevents further clotting. Nitro gets rid of the clot that's there. So used together, they can resolve chest pain until the patient gets to the hospital. But remember, with nitroglycerin, it has an undesired effect of lowering blood pressure. So because it causes vasodilation, that opens up the vasculature, and blood pressure as a result will drop. Sometimes really far, so we have to be careful. And in New York State, you cannot administer nitroglycerin to anybody with blood pressure under 120 systolic. Okay, and wherever region you go to, you have to find out that specific policy. In addition, it will interact with other drugs. Any drugs that are given for erectile dysfunction should not have nitroglycerin work with it because it will drop the blood pressure precipitously, extremely low. Okay, erectile dysfunction drugs were initially started to treat chest pain. They found out during clinical trials that the clinical subjects, the male subjects, were actually having sustained erection. So they said, hey, we're going to stop using this drug for cardiac and we're going to use it for its side effect. So because of that, it lowers blood pressure, and used with nitro, it potentiates nitro. It makes nitro stronger, so it can really drop blood pressure precipitously. The patient could pass out, so be very careful and ask the patient if they've taken it. How is it administered? Under the tongue, sublingually. The patient should feel some slight tingling or burning. That means it's still active. Storage is important because if it comes in contact with light, it begins to lose its potency. That's why a lot of nitroglycerin bottles are in opaque brown bottles, so light doesn't reflect through or refract through. When you're administering this medication, always take vital signs before you re-administer. So you take it, you ask them how they're feeling, 5 minutes go by. If they're not having chest pain, don't have to give them anymore. If they're still having chest pain, check their blood pressure. If it's within the acceptable range, in New York State, once again, is 120 millimeters of mercury systolic. It's within the acceptable range, you can administer another dose. You may have to call medical control. Once again, adhere to your local protocols. Now, intramuscular injections, advantage to that, fast. Easy access, you don't have to start an IV. And blood flow to muscles is pretty consistent and stable. So it quickly reabsorbs back into the vasculature. A disadvantage It's got a needle. People are afraid of needles, so they might be hesitant. Plus, you can end up sticking yourself, so you've got to have good skills in order to give this injection. Now, the most common intramuscular administration that you're going to have as EMTs is an epinephrine injection. Its trade name is an EpiPen. So what does epinephrine do? It is a stimulant that puts you into what we call a fight or flight, sympathetic response. So when you're in a sympathetic tone, when you're in fight or flight, okay, your blood pressure goes, you're ready for a fight. Your whole system is preparing for stress. So what ends up happening? Your heart rate increases, your blood pressure goes up, okay, your eyes dilate, your pupils dilate, your skin gets flushed and sweaty, and you breathe better. Your bronchioles expand because you're going to be aggressive, you're going to be fighting, you're going to need more oxygen. So epinephrine, an EpiPen is known as a sympathomimetic. What does that mean? It's a sympathetic mimic. It mimics the sympathetic tone of that fight or flight response. So it increases that heart rate and constricts blood vessels. That's not why you're giving the epinephrine. Okay? You're giving the epinephrine for the respiratory effects that come with anaphylaxis, the wheezing, because their airway's going to close off. You want to dilate the smooth muscle. You want the smooth muscle of the bronchioles to relax. You can't give it to somebody who has hypertension because they're going to get profoundly hypertensive. If they're having a heart attack, that's going to possibly cause more damage and could possibly kill them. This is done as an emergency drug for anaphylaxis. Right now, this is the emergency drug for anaphylaxis. We take a lot of risks because the alternative to letting them continue anaphylaxis is certain death. So we will take a chance at the complications to the heart and to the blood pressure because we have to save the patient. So being prepared is key. So when you give an EpiPen, you need to be ready for an untoward reaction like cardiac arrest. So be ready with your AED. So just to review anaphylaxis, what's happening? Well, the allergens from whatever patient came in contact with that's causing a systemic allergic reaction. It's an over response to a minor problem. The body is going to kill itself because it got stung by a bee or smelled peanut butter. So this is a very serious overreaction. Histamine has been secreted by every mast cell in the body, and the histamine is causing swelling of all the tissue. And our main concern, the tissue that is primary, is the trachea, bronchus, and bronchioles. And giving the EpiPen will prevent that swelling. Once you completely swell up, the patient will suffocate. So our inhaled medications, we have oxygen. Once again, non-rebreather, preferred method for those who are having trouble breathing. Those who can't tolerate a mask, get a nasal cannula. Meter dose inhalers and nebulizers are also inhaled medications. The absorption rate is very quick, easy route to access, and it's very portable. It's easy to give. So when you're doing your assessment and your sample history, the M stands for medications. Finding out what medications the patient is taking is a vital part of patient assessment. It's going to tell you clues as to the patient's underlying medical conditions. It will guide you in your treatment. Understanding what underlying issues they have. You're treating an asthmatic who also has a heart condition. This could be an issue. You might need to contact the physician and get approval for certain medications. And of course, it's useful in the emergency department. as part of their admission profile. So be thorough in your assessment. Make sure that you get all the meds, and if you need to bring them with you, that's fine too. If you need to use another continuation form to list more medications, that's fine too, but be thorough in your medication gathering and documentation. So what is pharmacology? It's the science of drugs. It includes their ingredients, their preparation, uses, and actions on the body. These are our routes. Remember the first two, rectal and oral, is enteral. The rest are parenteral. Medications come in different forms, and it's designed for the delivery. So you can't alter a form of drug to give it the way that the drug company did not specifically describe it to be given. You have tablets, solutions, MDIs, topical and transcutaneous meds, the gels like insulin glucose, and gases for inhalation. The administration of any medication requires approval of medical control, either standing orders, which is written into your protocols, or having to call medical control and get get an authorization to administer. The 6 rights of medication administration, remember, it's the right patient, the right medication, the right dose, the right route, the right time, and the right documentation. Make sure that you do a reassessment. Talk to the patient. How are you feeling? Okay, be ready for side effects. Be ready for untoward effects. Issues like with an EpiPen, cardiac arrest. Make sure you have your AED handy when you're giving an EpiPen. And document all of your treatment findings and the response to your medications. The medications that we carry as EMTs, activated charcoal, the oral glucose, aspirin, nitroglycerin, spray or tablets, EpiPens, both adult and pediatrics, and our oxygen. Knowing what medication the patient takes, it's vital. It's important because it's part of the entire assessment approach. Make sure you gather all the medications together and deliver them with the patient to the hospital, either in a bag or written down on your report. So let's review. So pharmacology is defined as what? It's the field of science that deals with the study of drugs and medications. So pharmacology is the study of cells and tissues, or the study of drugs and medications.